So no, we're absolutely delighted to be flying the flag for Wales here at the NHS Confederation, and actually to be part of the HSN stand and part of the Innovation Zone. So it's the first time that the Life Sciences Hub has taken a presence here, so we're absolutely delighted. So as Sian says, I'm Carrie-Anne Quinn, I'm the Chief Exec of the Life Sciences Hub. And I'm going to take you through a bit of a slide presentation that will really just give a flavour and an introduction to the way that we're working, how we're supporting NHS Wales and social care in Wales to really start thinking about some of the transformation activities and how we're working with industry to enable that transition to happen. But you know, it's been a very strange couple of years, and actually that relationship between health and industry is becoming incredibly strong, and certainly I think, you know, the collaborative working to a common goal and a shared agenda has really demonstrated and given us a glimpse of the art of the possible in a health innovation landscape, and certainly it's that momentum that we're hoping to capture and retain across the region. So in terms of the agenda, I'm gonna talk to you a little bit. We've got some videos to show you, and I'm really keen to allow a little time at the end for some Q&A. Out of interest, how many of you here are already working with NHS Wales? Fantastic. So we'll be keen to talk to you after this, just to get a feedback in terms of, you know, your products and your experiences, and see how we can work with you to take some innovations and really look at scale. And for us in the Life Sciences Hub, you know, that's really key, is ensuring that we're focusing on innovation that can be adopted across the region. So why Wales? Well, we've got a joined-up system, and really do offer system-wide support. We're really quite small, so we've a population of just over 3 million people, and the health system is structured so that it's looking at providing a single system-wide approach. That gives us a great platform for trialing products and services, and for demonstrating new ways of working, because as we run through the slides, you know, you will all already know that actually having access to patients, to gather evidence, to really be able to develop strong business cases and the case for change is absolutely essential. And actually that leads us to really needing to understand data. And within Wales, we have our SAIL database, which is an anonymised GP-led database system, which is incredibly powerful and helpful for young, innovative organisations to progress some of their research work. Skills, you know, we've got a strong academic network across the region, and some particular strengths in neuroscience, and many others. But for us in Wales, probably neuroscience is a really key area of work. And to develop new ways of working in innovation, funding is key. And we at the Life Sciences Hub are really creating an environment and a network that can support both the development of business cases, but access to funding as businesses need them. So, you know, we're very much about bringing that relationship and trust from health to industry. Now, I think I'm going to play a short video here.
Innovation plays a crucial role in improving our health and social care services. At Life Sciences Hub Wales, we are proud to be supporting this transformation. Wales offers the ideal environment for innovative working, thanks to its size, agility, and internationally recognised academic excellence. It also delivers effective partnership working across industry, health, social care and academic sectors. Our teams work closely with health and social care colleagues to better understand and identify the challenges they face, and in turn support industry to accelerate innovation to meet them. We work with leading experts and are proud to play a part in the development of some of the brightest ideas in digital, AI, precision medicine and advanced therapies that are already making a major difference to people in Wales. So whether you're a nurse, clinical lead or a company director with an innovative product or service, our expert team is here to provide bespoke support to accelerate your innovation journey. You could be a healthcare organisation based in Wales looking for support, resource or guidance, or a local, national or international company looking to engage in the healthcare ecosystem in Wales. We are here to help through our wide range of support services and programmes. We love a challenge and we're keen to hear about yours. Let's start a conversation about how we can help. Contact us today at hello@lshubwales.com or visit lshubwales.com to find out more.
Thank you. I'm so relieved that worked. Videos are always a challenge in a presentation. So in terms of how we work, we're very much focused on really supporting and accelerating the development of innovation, but with a focus on adoption. And you know, primarily we're recognizing that for all of us in this whole conference, we're working collaboratively to be addressing similar challenges. So it doesn't always have to be blue sky thinking and new solutions that are coming forward, but there's a real opportunity to work collaboratively, learn from each other and explore how scale can be achieved in a health innovation landscape. From a Wales perspective, we really are waving that flag and saying, you know, we're part of that infrastructure across the UK and working closely with UK government and aligning to the broader life science agendas and opportunities. And how are we going to do this? You know, we really are focusing on creating the connections, so bringing the right people together to ensure that the support we're able to offer industry enables them to progress their engagement and their product development forward. But everything we do starts with a health context, so it's very much about understanding the challenge, what are the problems that need to be addressed today, and how can we reach out to industry to ensure that we are aware of the very best ideas, the very best solutions that can be brought forward to bring those for the benefit of the health system and the benefits of the region across Wales. So very much starting with the need and bringing solutions forward. And in terms of how we're working, you know, this pathway will be familiar to all of you. It really is very much about guiding discussions between industry and the health system to ensure that projects and propositions are moving forward through the innovation pathway. You know, you'll recognise that some projects will start at the beginning here and work their way all the way through. You know what? There's going to be barriers and hurdles that you'll be encountering as you're trying to get new products into service and into the hands of patients. And our team is very much focused around identifying those areas and barriers and wrapping support around the projects to enable us to move things forward from one area to another. So, you know, that may involve horizon scanning to identify the very, very best technologies that can be brought forward. You may need funding, and it may be working with both public and private sector organisations to identify those sources of funding and offer some peer review and some guidance to help you access that funding support. We're doing a lot of project management and project support. And actually, in one of the talks earlier with the NIA, there was a lot of discussion focusing around trust. And actually, that's something that we're seeing in Wales. You know, how do we create an environment that really builds the trust and confidence for the health system to be engaging with industry, and really being able to be confident and comfortable in that collaborative network. And you know, we're deploying project managers to be able to support that relationship as we're working through. But our ultimate goal here is one of adoption, and then looking at how that can be spread right across the region. So for everything we do, we've identified just some key headline areas that we're focusing on as a priority, and I suspect these will be of no surprise. Precision medicine is absolutely top of our agenda, really looking at ways of being able to focus on early detection and diagnostics, ensuring that treatment pathways are more tailored to individuals, and as part of that, we do have a strong focus for advanced therapies, and a pathway that enables us to really bring forward these new innovative treatments to patients. So for advanced therapies, we're working closely with our partner organisation, which is Advanced Therapies Wales. And again, we work as the sort of industry engagement arm, the front door, if you like, for projects involved in cell and gene therapy. Early diagnostics and detection has been a key area for us, and it's been amazing to spend some time walking the hall and really seeing just some of the new technologies that are being deployed across the NHS. I'm really keen to have conversations to explore, you know, whether there could be an opportunity for some of these businesses to be engaging and working with us and the activities that we're bringing forward in Wales. We ran a workshop earlier this year that was bringing industries together, and we had 120 companies all come forward with some solutions, and we're managing to narrow that down now to just a handful, following some due diligence and really strong discussion with clinical leads across the region, and we're now at the stage of working up evidence-based business cases to enable those projects to start moving forward to the next phase. So you know, it's that evidence base and that data that is essential, and where we can support organisations to understand the stages they need to follow to ensure that the information they're providing is really going to address the needs of the health system. And in fact, we've just popped an example there. So Cytiva, earlier in the pandemic, actually established a new manufacturing facility to support the vaccine program, and have invested significantly with us and created just over 250 new jobs in Wales, and right from the get-go have been developing that as an international platform. So our team worked in partnership with UK government and the Accelerated Access Collaborative to enable that project to proceed, and you know, we've been delighted to be part of that overall process. And then I'm just going to take you to our other key priority area, which is digital in its broader sense, embracing robotics and artificial intelligence. And we really are working on a number of projects within this space. And actually, it's probably no surprise, again, as we walk through the exhibition hall here, to see just how many digital solution projects and opportunities are being developed and are being trialled across the region. I'm not going to talk to you about each one of these in the interest of time, but I will tell you that Healthy.io have an amazing smartphone-based app that is able to work with wound care nurses and really track the patient pathway. They've got a great stand just two stands up from us here. So if you get the opportunity, please go along and talk to the guys at Healthy.io and show you some fairly gory images, but I'm working on the basis that many of you will be familiar with those. We were able to support NHS Wales to roll out a national robotics project, and that was a project that was announced and formally commenced its rollout in April this year. And for us, that was a step change because we were able to develop a strongly justified business case, take on some of the overall project management that worked alongside the procurement mechanisms and really were able to support the process of working with a UK-based company, which was the successful candidates, to really integrate and bring that forward. You know, the patient benefit associated with projects like this is really, really significant in terms of recovery time, being able to have in place really strong data to support their surgeries, because actually, you know, if we're thinking of procedures like bowel cancer, often there may need to be repeat procedures in later life, and actually the data that is provided by the robots is really quite significant. So, you know, really pleased to see that Wales is taking a national approach to that project. And actually for us, you know, wouldn't it be great if we had a national system for lots of things that we're doing? And we very much see our role is working with you to support that spread and scale to achieve some of that national activity. I've got another video to play you, so fingers crossed this one's going to work too. And this is just introducing the Humour project, which is a cardiovascular remote monitoring system. I think this one I need to press twice.
Wales is home to a dynamic innovation ecosystem that is helping to transform our health, well-being and economic landscape. Life Sciences Hub Wales is
I assume that was me. Sorry.
Wales is home to a dynamic innovation ecosystem that is helping to transform our health, well-being and economic landscape. Life Sciences Hub Wales is proud to showcase the latest developments from industry, academia and health and social care.
So Humour is a health tech organisation, and we use people's smartphones to give them hospital care, monitor their health and enable them to participate in clinical research, all done remotely. So Humour's technology shares health information between patients and clinicians. It includes a patient app and a clinician dashboard. The Humour app, as used by a patient, allows patients to submit and report things like blood pressure, heart rate, as well as things like symptoms and answers to clinical questions. Clinical teams can then review that information through the Humour dashboard, which flags automatically patients that may be deteriorating or warrant further attention.
The main challenges were COVID had hit the UK and we were unable to see our patients face to face. My nursing team had been redeployed to wards to cover COVID patients, so we were really struggling to see our patients face to face. So this app was able to facilitate us virtually monitoring our patients from their own home. So the footfall was less to our hospital. Patients didn't have the fear of, catching COVID coming to see us. So it was a real game changer through the COVID period.
So my mum is 65 years old and unfortunately earlier this year she was diagnosed with heart failure. But fortunately she's been able to use this new app. The impact of having heart failure alone is huge on your quality of life, your symptoms and everything. Actually using the app has meant that my mum has had access to a heart failure specialist almost on a daily basis. The fact that people can get to where they need to be in their treatment plan a lot quicker and don't have to go back for a hospital, particularly in a pandemic, which we're trying to avoid, it's a win-win situation.
The Life Sciences Hub Wales has seen many digital applications in the past 12 months that have enabled remote monitoring. So the Digital Solutions Fund was set up by Welsh Government with reference to COVID challenges and how we'd use technology to enable healthcare to meet those challenges. The application, in this case Humour, won that challenge and won funding to be applied to a health board, and worked with CumTaf on development of the application, and then with Betsy Cadwaladr as well for evaluation of the application in use with patients and clinicians to enable us to determine if the app was fit for purpose for future use and adoption.
So there's lots of challenges involved with monitoring patients, communicating with patients, reaching patients, and then being able to travel to you with their heart failure condition. Now using the remote monitoring app, I'm able to see on a daily or alternate day basis the trend that's happening with my patients. I can have a look at that and decide whether I'm happy where my patient is, and it's more upstream. So rather than them not wanting to phone because they're worried about bothering me, I can see, I know this patient, I know we're heading in a direction that I'm not happy with, and I can jump onto the phone, have a video consultation with them, or call them into clinic, depending on what that clinical scenario is at any given time, and reverse that trend and avoid hospital admissions and keep patients better for longer.
Well, I wasn't aware that I had had a heart attack. It's only when they were searching for something else that they told me. Since then, and with the help from my heart specialist nurse, I've been able to survive, and with her help, I keep saying this, I wouldn't be here without her help. If Vicky, my heart failure nurse, notices something not right, she will give me a call and say, I think you need some extra tablets.
The pilot has been really successful thanks to our collaboration with CumTaf Morganwy and Betsy Cadwaladr health boards. The clinicians have told us that the app has allowed them to spot deterioration and intervene early. On top of that, clinicians have been able to discharge patients early from hospital because of the monitoring the app provides. Patients have universally given us positive feedback too. It's helped me better manage my cardiac condition, which is so important for heart failure, and they've almost universally rated the app extremely highly and would recommend to other users.
I think this innovation has the capacity to help people across Wales, across the UK, across the world. So anybody with heart failure that this could potentially benefit.
Life Sciences Hub Wales is working collaboratively to make Wales the place of choice for health, care and well-being innovation. Join us as we make our vision a reality, and contact us at hello@lshubwales.com or visit lshubwales.com to find out more.
Thank you. Sorry, that was probably 4 minutes long, so that was a long video to watch. But for us, it just tells a lovely story from the patient's perspective, from the clinical team's perspective, and actually, you know, you can see here how being able to take innovative solutions into the community so that patients are able to access treatment or data in a place and in a way that is more accessible to them, I think is definitely a trend that we are seeing right across healthcare. So just to conclude, you know, I've given a little bit of a flavour of some of the things going on across Wales, but actually what we're really looking for is how can we help build our networks and our partnerships. We need to know about your businesses. We need to know about your products to really be able to showcase them and to be able to surface them as solutions when challenges are identified. We want to know what you're doing in your health board, because we are very happy to work with projects that have already been evidenced and actually maybe a consideration as a solution coming forward. You know, we're all working to similar challenges, and really keen to explore how by working more collaboratively that we're maximising the impact of health innovation right across the UK. So we're really keen to hear from you. Some of the team are here, but also, you know, I'm sure colleagues from HSN would be very happy to make connections, and I'd be delighted to speak to all or any of you over the course of this afternoon. And just before I finish, because I can see time is moving forward, I just wanted to flag that we are currently launching, or we're currently running our series of Healthy Thinking podcasts. The most recent one was launched on Tuesday, which is actually by Kathy Scott from the HSN, and a focus there on sustainability. There's been a few more podcasts before that, so take a look and have a listen. And this week will be rolled out over the coming weeks. So every Tuesday there's a new one. And please sign up, and look forward to hearing from you. I'm looking at my watch. I think Joe's going to let me have 5 minutes for any questions, if anybody would like to ask one. Emma, hi.
Thank you. So obviously today you're in sort of conjunction with the other AHSNs through England. How integrated is that on a daily basis? For example, if something's going on with an AHSN and we're working quite closely with them, nationally in England, that arguably people talk, is Wales part of that conversation as well? Is it one happy family, I guess I'm asking?
So we're not an AHSN. So the Life Sciences Hub Wales is a wholly owned subsidiary of Welsh Government to support both health and economy agendas. So we have a sort of slightly broader remit. However, you know, we're absolutely delighted to be building our relationships with the HSN, and really becoming more integrated in some of those conversations. It's not necessarily a seamless flow through, so you know, please reach out if there are projects that you feel we should be aware of. But in terms of project pipelines, we are beginning to share data and expand that collaborative working. Thank you. Brilliant. I'm not seeing any more hands, Joe. So thank you very much. Delighted to see you all today. Thank you.